How does proton therapy work for brain tumors? Imagine using a highly precise beam of energy to target a tumor in the brain while protecting the surrounding healthy tissue. That's what proton therapy aims to do. It's a specialized form of radiation treatment that uses protons instead of traditional X-ray beams. This approach is especially useful for brain tumors because the brain has many vital structures that need to be preserved during treatment. Proton therapy works by harnessing the unique physical properties of protons, which are positively charged particles. When protons are directed into the body, they travel a specific distance called the range, and then releases most of their energy at a precise point known as the Bragg peak. This means that the maximum dose of radiation is delivered directly into the tumor, with very little radiation spilling over into the healthy tissue beyond it. In contrast, traditional X-ray radiation continues to deposit energy as it passes through the body, affecting both the tumor and the normal tissues along its path. This precise targeting is especially important for brain tumors that are located near critical structures like the optic nerves, pituitary gland, hippocampus, which is involved in memory, or the cochlea, essential for hearing. By minimizing radiation exposure to these areas, proton therapy can reduce side effects such as cognitive difficulties, hormonal imbalances, hearing loss, or immune system damage. One of the main benefits of proton therapy for brain tumors is the potential to lower the risk of side effects while still effectively controlling the tumor. Because less healthy brain tissue is exposed to radiation, patients often experience fewer problems with memory, thinking, and hormone function. This is particularly valuable for children and young adults, whose brains are still developing and who may live many years after treatment. Proton therapy may also decrease the chance of developing a second cancer later in life, which is a concern with any form of radiation. Clinical studies have shown that proton therapy can lead to longer periods of disease control and sometimes improved survival rates for certain brain and spinal tumors compared to conventional radiation. Patients treated with proton therapy often report fewer immediate and long-term side effects, though individual responses can vary based on the tumor and overall health. It's important to understand that proton therapy isn't suitable for everyone. The decision to use it depends on factors like the size, type, and location of the tumor, as well as the patient's overall health and treatment goals. It is often chosen for tumors close to critical brain structures, for pediatric patients, or for those who might benefit from reduced side effects over the long term. Treatment usually takes place over several weeks, with each session lasting a short time, often around 30 to 60 minutes. Advanced techniques like intensity-modulated proton therapy allow for even more precise targeting, further sparing healthy tissue. While proton therapy offers many advantages, it is not a cure-all. It is still a form of radiation and can cause side effects. Not all hospitals have proton therapy facilities, which can limit access. Ongoing research continues to compare proton therapy with other treatments and to identify which patients are most likely to benefit. As with any medical decision, it's essential to consult with healthcare professionals to determine the best approach based on individual circumstances. In summary, proton therapy provides a highly targeted way to treat brain tumors, delivering radiation directly to cancer cells while protecting the surrounding healthy brain tissue. This precision can lead to better outcomes, fewer side effects, and support long-term brain health. But it remains one option among many, and the best treatment plan is always tailored through careful medical evaluation. If you or a loved one are considering treatment options, always speak with a medical team experienced in brain tumor care to find the most appropriate approach.